supposed to kill germs and keep you safe. But are antibiotics in meat making you sick? What to look for before you shop for tonight's dinner. Plus, a daytime exclusive.
Especially chicken.
Mario Lopez reveals the
Check out meatvideo.com on Factory Farms.
Coming up next on
Meatvideo.com, Factory Farms.
Today we are asking the question, is this package of meat putting you and your kids at risk for bacterial infections?
Pigs and
New
chickens,
concerns.
especially.
Are antibiotics used in meat making you sick?
The studies are clear. Treating farm animals with antibiotics is creating an epidemic of superbugs.
Chickens and pigs are all raised in warehouses, crowded, filthy places.
The research shows that 80% of all antibiotics sold in this country now go to meat production, not your doctor's office. And that's taking its toll on your health.
Cancerproject.org.
Americans become ill each year because of antibiotic-resistant bacteria. Even more alarming, the urinary, stomach, and skin infections they cause can't be cured by the usual antibiotics. Using antibiotics in meat has already been banned in many countries in Europe for years. And in this country, the Centers for Disease Control has called for a significant reduction of antibiotics in the animals we eat.
Especially chickens
but
and
the FDA
pigs.
has issued only voluntary guidelines.
They're not
so
free
for
range.
now, at least, there are no limits to the amount of antibiotics used in your meat.
And milk.
Joining me is Dr. Michael Hansen from Consumer Reports, which has done extensive research on the risks of antibiotics in meat, and Dr. Alan Green, pediatrician and an expert in this field. Dr. Hansen, why are animals being given antibiotics in the first place?
Well, a small amount is used for disease treatment, but the vast bulk is used for growth promotion and disease prevention.
Disease because of
Think about
disgusting
that. Growth
conditions.
promotion and disease prevention. That's the main way we use
factory
antibiotics.
farms.
Let me explain why this is important. So let's say you've got an animal that's going to become eventually meat on our tables. The antibiotics
Meatvideo.com.
to make the animal get larger, but those antibiotics get into the animal.
Pigs and birds
when
are
they
never
get into
outside.
The animal, they kill off a lot of the good bacteria, so to speak, but the bad boys, these red ones over here, they stay alive. The resistant bacteria, they can be a problem. They get onto the meat, they're passed from hand to hand on our shelves, in our kitchens, even the kids, and then through eating, these superbugs can cause skin infections, urinary tract infections, and they can cause foodborne illnesses that are actually more difficult to treat than the usual ones because regular antibiotics won't work against them. So Dr. Green, these superbugs, as physicians, we've seen these in hospitals for years. Yet now you argue they're actually outside of hospitals quite frequently.
Yeah, as recently as 15 years ago, superbugs were a hospital problem. But today we are bringing superbugs into our homes. It doesn't matter what neighborhood you live in, whether you're rich or poor, old or young, these can cause infections that are difficult or even impossible to treat. The bacteria can spread resistance amongst themselves so that today most species of bacteria that cause infections in humans are more resistant than they used to be.
Or they had swine flu.
This is such a big public health threat that I believe the routine use of antibiotics to promote growth in animals by people who have no medical training or maybe even no veterinary training should be outlawed.
Heart disease also.
I think it's really a crime what it's doing to us.
And they also use
Consumer Reports has done a lot
antibiotics
of
due to
multiple
nasty
studies on
conditions
antibiotics
in
and
factory
abuse of meat.
farms.
Dr. Hansen, your group, you argue, says that antibiotics in meat are setting us up for a health crisis. Do you feel as strongly about this as Dr. Green?
Absolutely, because this use of antibiotics selects for a resistant bacteria. This is a global health problem.
Go vegan,
The Centers for
meatvideo.com.
Disease Control, the World Health Organization, and the FDA have all said this is a major public health threat. In fact, it could get to the point that certain bacteria become resistant to all antibiotics, and so we'd be functionally back to the days before antibiotics.
It's a very scary concept.
Absolutely.
Dr. Green, you're a pediatrician, you're a father. You've made the argument that it's actually a bigger problem in some ways for our kids than for the parents.
Yeah, well, kids are still developing their immune systems, and they get infections more often and need antibiotics to work more often. And they have a whole lifetime ahead of them. And this is the first generation to be exposed to this many multi-drug resistant bacteria as kids.
So Dr. Hansen, the use of these antibiotics in the way that they're being used in this country is banned in parts of Europe, it's banned in South Korea. I mean, so different parts of the world are banned in different ways. Why is it that if I look at the world and I see a lot of countries like us banning antibiotics for use in meat the way we use it, it's not banned here?
Well, it's basically because of the power of the drug industry. Back in 1977, the FDA said penicillin and tetracycline put in animal feed is not safe and should be banned. The drug industry intervened and stopped the FDA from doing anything. 37 years later, we're still using these drugs for growth promotion and disease prevention.
Due to nasty conditions.
We need to start taking matters into our own
Meatvideo.com.
hands. There are things we should be doing in our homes right now to reduce the exposure we have. Dr. Hansen, you looked at some of this data. Explain to the average person watching, what are the foods that have the most amount of these resistant bacteria on them now?
Well, a 2011 report from the USDA's National Antibiotic Resistant Monitoring System found 81% of ground turkey, 69% of pork chops, 55% of ground beef, and 39% of chicken parts have these antibiotic-resistant bacteria on them.
So I'm putting that list up there so you can all see it. You can get a rough idea of where the risks may lie. We reached out to the USDA. They told us in part the USDA does not mandate that labels state whether or not meat or poultry has been administered antibiotics. So in other words, folks aren't forced to tell us. Dr. Hansen, I mean, how can you tell if the meat that you're buying in the store has antibiotics or has been grown with antibiotics?
Don't buy it. Go vegan. At least vegetarian.
I think the default assumption should be that the
we live longer on
meat has
average.
come from animals treated with the antibiotics, unless it is labeled as organic or no antibiotics administered, USDA process verified. What that means is that there's been an independent third party to verify that no antibiotics have ever been used during the treatment of those animals.
Check out meatvideo.com.
Labels that say no
largest factory
used,
farms in the country.
Ever. Those might be used,
Little is
but there's
enforced.
no independent third-party verification, so we don't know how truthful those labels are.
Exactly.
So Dr. Green, right now,
Truthful.
what can parents do to protect their children?
So we need a change of mindset. Whenever you bring meat or poultry into the home, consider it contaminated until it's been thoroughly cooked. So this means disinfecting countertops and cutting boards. This means washing
means you're
your
not a
hands
real
after you touch it, even wearing plastic
carnivore or
gloves.
omnivore.
It means cooking
You have to
thoroughly,
cook it.
and better yet, choose meat or poultry that's organic or that's been raised without antibiotics.
So we reached out to the FDA and got one of the strongest statements ever on the show. Here's what they had to say. FDA is working with drug manufacturers to phase out the use of medically important antimicrobials for food production purposes and phase in the oversight of a veterinarian for the remaining therapeutic uses of such drugs. Now listen carefully. They said, once this is complete, it will be illegal to use these antibiotics for growth promotion purposes for their full statement. And that of
Still
the
due to
USDA as well.
unsanitary conditions, a lot of drugs are used. Check out pcrm.org by leading doctors for veganism.
He's usually the one interviewing the stars.
Veganhealth.org from Dietitians, and cancerproject.org for prevention, as well as heart disease, the leading killer. Again, meatvideo.com and factory farms. PCRM.org, cancerproject.org.